Hello, everyone, and welcome to this afternoon's workshop. I hope you had a nice lunch break and are ready for an interesting and insightful session now. I'm Dore from WWP, and I'm going to moderate today's workshop. We're joined by Dimitra Mincidis, who you can already see in the chat. She is our financial and project manager at WWP. Just before we begin, to let you know, this workshop session is being recorded, but breakout rooms will not be recorded. So please feel free to leave your camera on. At the same time, please keep yourself on mute, except when you're speaking, so we don't have any noise interruptions. Please leave any comments or questions you have in the chat. And if you would like to share anything on social media, please use the hashtag criticalcases23. Before we begin, I am going to give you an introduction of our facilitators today. The workshop will be conducted by Silvia Amazzoni and Nicholas Pitsidis. Silvia is a psychologist and part of the professional staff from the CAM Member Association based in Italy. She has decades of experience working as a facilitator within intervention groups with men who are perpetrators of violence. Currently, she deals with partner contact for perpetrator programs, in addition to working in interventions to raise awareness, training, and prevention of gender-based violence in Italy and abroad. And she's the coordinator of the MOVE project, which she will be presenting. Nicholas Pitsidis has been the coordinator of projects at the Union of Women Association of Herakli in Greece for the past 11 years. He is the coordinator of all national and international projects of the organization, and he acts as a strategy advisor to their board. He participates in advocacy meetings with national or European policy stakeholders and politicians. We're all really excited to have you here today and are looking forward to an insightful workshop. So I guess since we're all here, let's begin. It's over to you, Silvia.
Okay, thank you, Dure. So I'm gonna share my screen. So good afternoon, everyone. It's such a pleasure to be here with you. Thank you very much to be part of this workshop today, and also want to say thank you to WWP to organize the annual conference, of course, but also give the opportunity for sharing and discussing these topics. I'm Silvia Mazzoni, and I'm psychologist. I work with CAM, the Italian-based association. It is the first Italian perpetrator program in Italy. And also I am coordinator of the MOVE project on behalf of CAM, as it is the lead association of this project, started in 2022 and almost came to the end of the years. So the MOVE project was interested in responding to culturally sensitive, effective, and sustainable work with male perpetrators of domestic violence, especially those with a migrant background. So first of all, I want to tell you why we decided to carry on the MOVE project. Secondly, I would like to show you and talk a little bit about the initial challenges we encountered, and also with challenges faced during the project. Then I want to explain you, show the lesson learned, and introduce the guiding question for the breakout room sessions. So why the MOVE project? Let's start with some data regarding the trend of the migrant waves and how there have been numerous arrivals, especially in the countries where we then decided to carry out the project, in particular Germany, France, Italy, Spain, and Greece. We know that the most of these arrivals are migrant men and are from Mediterranean Sea. Also, so we can see, for example, in Italy, in the perpetrator program, in the recent years, we see an increasing number of migrant men accessed to the program. even are often forced or mandatory by courts. So for this reason, we consider the importance of responding to two identified needs. On one hand, the importance of training frontline professionals working in migratory contexts to address risk factors and identify indicators of violent behavior. And for other hand, engage professionals, especially who work with men in perpetrator program, to share a culturally sensitive and anti-racist approach to addressing GBV. Last but not least, the importance to create a multi-agency model that allows services to create a collaboration. These have been three big actions of the project. Also, what we found through the need analysis results, so we found that the perpetrator programs are not adapted at all to the migration background, despite the increase in the number of men with migrant background entering the perpetrator program. Sharing cultural elements of origin and immigration projects for men with migrant background bring benefits and advantages during the intervention program. There is a lack of language support in perpetrators program for men with migrant background, and also the perpetrator programs don't receive referrals from migration related services, and no coordination at all between them. Also, frontline professionals need to learn how to approach gender-based violence and how to talk about it with men with a migrant background. What were the initial challenges that we faced? So first of all, the complexity and sensitive of the topic. Also, the risk of stigmatization for migrant men, because there is a risk, so we saw some risk to put together the word violence with the word migrant, so the risk to produce a stigmatization effect. So this was a big challenge for us. Also increased knowledge and good practice for culturally sensitive work with professionals in perpetrators program, but also provide useful elements for frontline professionals to allow them to be trained in detecting violent behavior, but also reflect on stereotypes like men perpetrators of violence can bring some stereotypes, more if is migrant, and how to talk about violence with men. During the project, the challenges that we faced were, of course, still the complexity and sensitivity of the topic. Be tightrope walkers, so have a culturally sensitive approach, but do not justify violence with cultural elements. Create a greater connection between migrant communities and perpetrator programs. We found numerous and various stereotypes and structurally racist behaviors at an institutional level. And of course, we found a lack of professionals with migrant background within the perpetrators programs staff. What are the lessons learned? So first, the importance for professionals to reflect on their own stereotypes and cultural bias when working with men with a migrant background. Of course, be aware of the white privilege for perpetrator staff and frontline professionals. Use a culturally sensitive approach for professionals of perpetrators programs, so don't take anything for granted. And be aware of how often we have cultural lenses through which we view people, especially ethnocentrism lens. The importance to involve cultural mediators and interpreters during the whole process, all intervention, but of course also the need to train professionals and mediators to work together with men. The importance of network among the services and perpetrator program and the standardized practice for referrals and returning information. Also, of course, needs do some structural changes to perpetrators programs. For example, so need providing, of course, language support for men with a migrant background, being detailed and specified in contextualizing the perpetrator program service for migrant men when we explain and introduce our services, like what it is, what we do, providing legal advice, and paying attention to migration history and the current situation, like primary needs satisfied or not, aspects of the family of the origin. And also inserting elements of cultural sensitive during the perpetrator program can facilitate the integration of migrant men within the intervention group, be sensitive to racist or exclusionary dynamics within the intervention group among participants, and need to train professionals with a migratory background. So need to be included, of course, within the perpetrators programs. Now I introduce the guide questions for the breakout room sessions. And so the first is, do you see any difference in the perpetrator work approach and practice when we refer to men with migrant background? And the second one is, what are the three most important challenges for your own perpetrators program to respond to diverse groups of men?
Now we're going to move on to the next part of the workshop, which is a presentation by Nicholas Betsides, who will present the MOVE model, guidelines, and materials. So it's over to you, Nicholas.
Thank you very much. I'm Nicholas from Great Greece, the Union of Women Associations of Iraqian. And we tried through the MOVE project to design and try to test a model of a multi-agency model for handling migrant male perpetrators. We mainly discussed about migrant men and less of refugee men who are in the refugee status, because that would include some more parameters on the model, and of course would bring some light to some blind spots that we have in our countries on dealing with cases of violence at refugee communities. So the model that we designed and we try to discuss is a multi-agency model for frontline services and perpetrator programs. It is comprised by 8 steps and milestones. We are going to describe the interactions, the flows between the actors, and of course the conditions for implementation. Again, this multi-agency model is a try to understand and stipulate the processes, the agents, and the flows that we face in our countries, not only in Greece or South Europe and so on. And the idea is that we try to understand and work with the interactions between actors, and try to facilitate a smooth process for coordinated response and maximization of the safety of women and children at the end of the day. So the idea was that why this multi-agency model, because the perpetrators of violence are considered of a risk group that needs attention, of course, and intervention. It's necessary to identify high-risk perpetrators through a mutual assessment, risk assessment procedures, considering the episodes of recidivism that they somehow experience. There is a need for specific responses to issues related to culture and gender roles. And of course, we see that there is a need for all the involved professionals to take into consideration that male perpetrators of migrant backgrounds suffer from deeper socioeconomic trauma, with possible further implications regarding severity, frequency, and occurrence of violence. It's of vital importance to establish a structured method of identification, effective management, work with an action plan, including cultural sensitive and individualized interventions. Therefore, to put in place an effective referral pathway for an effective coordinated response. The sources of the model, the design of the model was the CCR. The CCR model, the multi-agency collaboration in perpetrator programs that we have seen in research, ongoing research in Europe, and of course the interaction and the flows and the data that we have with our interactions with the migrant communities in partner countries. So this was the flow of design of the model. We see three major actors, not actors like wheels on the process. This is the perpetrator programs. This is the victim support services and the agents of working with the community, like police, criminal justice system, social services, migration services. So stakeholders and professionals directly involved with the management of incidents of violence are key issues of frontline stakeholders and professionals who are work with the management of cases, like police, criminal justice system, prosecutor. What is the role of the prosecutor office, the judicial authorities, social services, migration services, reception services, child protection, school and early care education, parent and family support centers, and of course, healthcare structures and community. We see 8 basic principles of the model. And the first is a common understanding. That is a common understanding about violence, about the gender stereotypes, and about the care, about the culture. So what we need to put in place is that we need to establish a common understanding. That is, what is the definition of violence? What are the risk factors? What are the risk assessment tools? Institutional and political and cultural violence sometimes that takes place. We focus on victim protection and perpetrator accountability, awareness of different socialization and expectations for girls and boys, impact on gender cooperation, knowledge of human rights framework, of course, knowledge of immigration and law, procedures, the legal framework, the different aspects of migration, the impact of cultural diversity, and of course the structural and systemic violence that takes place in our places. Then we go on guidelines and policies that we need to put in place, that we need to have in place, like standardized protocols of cooperation, policies and methods, and working conditions, for example, to be sufficient staff in place, like referrals of perpetrators to judicial authorities, and the provision of supporting resources networks, among others. Networking is important. Networking is important for information sharing, interagency communication, and decision-making procedures. Who takes a decision? With whom are we networking? How are we networking, and what is the case of network? I would put in place, I would put emphasis the risk indicators, and of course to have a clear methodology that we share with different stakeholders. Monitoring and tracking procedures, we need to have a methodology in place and agree upon a methodology. We need to have data and discuss about the data, and of course to discuss about efficiency. That means that we need to have follow-ups, we need to have mutual evaluation, let's say evaluation follow-ups processes. We need to have development of an optimized victim support system. The main aim on that level is to ensure the safety of the victims, the survivors. We need to these services need to be optimized within this process. There are some the important element on this level is risk assessment and the awareness of intervention procedures and steps by professionals. The referral to specialized services to know how we deal and how we organize referrals, either at bilateral or multilateral level. The sixth principle is dealing with migrant male perpetrators, and then is somehow migrant men are often treated as criminals or perpetrators, and are punished due to the prejudice and cultural relativization of violence. Sometimes male migrant perpetrators may be easily and easier accused of violence against women, and of course sometimes the system acts at more active removal of children from perpetrators after complaints against them. Professionals need to recognize the equal rights, funding, and resources, and this is quite important for us. Number 7 is addressing the harm that violence against the women and girls cause to children. So we need to be aware about child protection intervention and parental issues on our multi-agency collaboration. And the dual action objective of the model, that is victim protection, training, and of course the management of migrant perpetrators, the provision of resources and accessibility to social assets, for example, health, employment, education. The idea of learning on a multicultural agency cooperation, we need to know our stereotypes and get rid of them in a way. The provision of resources is very important, and accessibility to social assets like safe shelters, health, employment possibilities, education, and other access, easy access to social assets. So we see a graphic illustration of the model of cooperation, that we see the migrant men on top, on the center, and we see the first line of interaction is the perpetrator programs, victim support services. We see very close collaboration of 2 main pillars, and of course police, hospitals, and migration services in place. The criminal prosecutor's office in some countries, they play pivotal roles. In other cases, in other countries, not lesser. The social services, employment services, we deem very important. that provide like access to employment, and of course the actions around them, that is risk assessment, gender sensitivity, referrals, case management, counseling, cultural sensitivity, legal and judicial measures. So we see that these interactions and these actions are in place between agents, and all stakeholders should interact directly with every incident of violence against the women and girls committed by a male perpetrator at three phases. Like the functional interaction could be a two-way and cyclical and complementary. That is, the first phase is police and criminal justice system, migration and social services. The second is like the social assets, like mental health, legal, healthcare, child protection services, and then we go to perpetrator program and victim support services. So this is the main interactions that we see within our model. The first phase, of course, all professionals need to be trained in the recognition and identification of both victims and perpetration of violence, knowing and applying risk assessment tools. We provide quite great emphasis on risk assessment tools. Services that provide, the second phase is that services that provide secondary interventions, like social services, recreation centers, are structures which are not so specialized to support perpetrators, but they need. They cover needs arising from the initial assessment, and where they cannot be met on phase one. And of course, this second phase, it's possible for the same service as in phase one to be included in this category, or other services with more focused services to which beneficiaries could be referred. Then we see a flow that goes back and forth. That is that the services that provide focus and specialized psychological intervention for perpetrators, and the perpetrator programs and victim support services are included in this flow. They provide psychological support, counseling, and treatment following the development of case management plan in collaboration with all the services involved. And this is where we deem as very important the sharing of information, the sharing of our experiences between professionals under a very safe mode, so to protect personal data, of course, and to minimize the risk of compromisation, and take into consideration that services in this phase may cooperate with services in the phase two. A referral is possible to be made, of course, and then we go to phase one and phase three. So the intervention methods, we start from, we need to have like, we need to think about cultural issues that need to be considered as well as cultural sensitivity. Risk management mitigation needs to be considered as an effective process to ensure multi-agency collaboration through monitor, support, and supervision and safety planning. And of course, we see some steps for cultural competence. We are all familiar with that. So we see that the process of coordinated response starts from initial assessment, goes to risk assessment, moves on to referrals. Then we move on case management. Counseling is very important, counseling, and the pathway of counseling. And of course, the legal and the judicial measures that we need to have in place. The conditions for the implementation of the model are all stakeholders need to put in place a formal, stable, and clear method of networking, cooperation, and coordination. Use an operational mutuality, accept the referral pathway. Use cultural and human rights sensitive communication strategies and techniques. use we would like to see mutual risk assessment tools. However, we know the challenges that may arise on that, and risk management elements follow an intersectional perspective, so to avoid any kind of institutional violence. And of course, services and professionals involved should have a mutual understanding, share common values, should prioritize collaboration to properly respond in any cases of violence against women and girls by male perpetrators with migrant background. This was the illustration of the model.